Hey everyone, welcome. It's been a bit. Welcome to 2026, and as you can tell, like I'm in a new location, different setting, different scene. Still trying to. I still have boxes, as you can tell, unopened or some open but halfway worked. So it's been a lot of changes. I'm in a new place, and the year has started, but at the same time, it's already February. Crazy how time goes quick. Um, really just wanted to take some time to check in again. I know it's been a bit. For those that have been following, my work, my creator series that I've been doing, so to speak. Really grateful. Thank you for being so patient. Navigating a busy dad life, work life, traveling to New York City, working in Jersey, New York, New Jersey. Back and forth that big commute, and now I'm in a new place where my commute's a little longer, not as like close. Um, it's not terrible, but it's just a little bit more. And now, especially, it's like the heart of winter, post like frozen, like a feet or 2 feet of like snow piled up on the sidewalks and crosswalks. So it's been a lot of changes in the last couple of weeks. I was away for a work retreat in January, up in Saratoga, which was pretty cool. But yeah, just kind of hitting the ground running this year with, kind of like a new role as well at my job, like in a good way. And yeah, just really trying to center myself a little bit more, trying to be more intentional about my health. I think I've been a little bit more open about where, some of the things I've been trying to do to be healthier, and some of the things that maybe haven't worked out as much. Well, I'll say this: I think like I've been, clearly, you guys remember when I tore my ACL a couple months back, almost half a year ago in June, and unfortunately, I have not made that much of a headway. Like, yes, I'm walking. I don't know if I can jog or run because that hasn't happened yet. I haven't. I've kind of fell off on my PT since September because it was my last quarter. It was an incredibly busy time, all the way till the end, just a sprint. So it's been challenging. It's been challenging, and I don't want to. I don't want my PT recovery to like just fall to the wayside and never really regain my strength or actual function or ability to move again. Not that I need to play soccer again at that level, but at least I would love to run, jog, lift, squat, maybe do a high rocks event again. I kind of miss that. That would be an awesome goal if I can get into high rocks, although it's a little bit intense. I don't know if I can recover, handle that, even with like PT or training, but really just trying to, center myself, get back to being healthy. I've gone to a couple of doctor's appointments already. I usually wait to the end of the year or don't even go or skip out on it. But I've been intentional about going. Saw a dietitian. Excuse me. I've been nursing like this 3 week cold and chest congestion that I guess has been going around. But really just trying to, get back on health, get back on track for my family, for myself. And, I've even gone to see a dermatologist just to like, improve my skin a little bit. So I'm all about it now, like it's your 40s, and it's just about really trying to do what's good for you and your health and regain that back. Otherwise, it's a really, really slippery slope from 40 and on, where like you can really just, if you don't take care of yourself, do some real damage. It could be accelerated and sometimes irreversible, or even just damage that's going to like affect you for years. And I don't want to get to that level. So, trying to find a gym or a routine where I can do something local here at my own pace before I jump into like those hit classes. 'Cause I do love those hit classes, but I don't know if I'm ready to keep up and then like consistently be modifying everything, which is not a bad thing, but I just, it's a big team thing. And if I'm not the one that can't help, or if they're doing partners, I feel like I'm kind of taking away the experience from somebody. So I'm leaning more towards like just like a basic gym where I can go. There's a little green turf area where I can work out. I think, my own pace, do my own rehab there, PT, to like regain that strength. Because I do need to drop like 20, 30 pounds, like realistic, probably more, 30 pounds or so. I'm a little bit on the heavier side now in 2026. Have been trying to do my best to get back on track, but busy dad life, commute, work, um, just a new move, new scenery. Like, just haven't gotten into that flow of routine yet. So trying to, and that doesn't help that I've been sick for the last like 3 weeks, basically for the month of January. I think I've been sick with a cold, congestion, something running. My whole family got sick. So, trying to be more intentional as now we're heading into February. And, it's interesting. Like, everyone's talking about like, how to lose weight. Obviously, there's a traditional way, work out, do what you have to do, diet. I want to do those things also, but I feel like I'm at a point now where I need maybe like medicine or some support to help me get there a little bit sooner before, I get really sick. I mentioned before, I've been open about like having like fatty liver, and trying to maybe get prescribed something, maybe like a GLP-1 or something, or one of the GLPs to just kind of help kickstart that, so I can, start losing a little bit of weight while I'm working out, get a little momentum, and hopefully like, build good habits with that, not reliant on it and like eating like crazy. But, I've been trying to get it. My insurance has been denying me left and right. And I don't want to pay like $800 to $1,000 for a monthly medication, especially, if I believe my insurance can cover it. And, part of, getting that authorization or second reauthorization so that my insurance can cover it was that, I had to do a sleep apnea test. And I actually did it. I took the sleep apnea test, and guess what? I have sleep apnea. I think they said like moderate. I'm not surprised there because, I've gained a little bit more weight. And, with that comes like, you're breathing, you're sleeping. So I have sleep apnea. So I technically qualify now. And so now just waiting for my insurance to come through with that. And I think I actually got like another rejection letter. I think it was, they called me earlier, but I was at work, I was working, and they couldn't pick up, and said something about my authorization. So it sounds like they probably denied me again. I don't know why. I'm actually open now to taking one of the GLP-1s just to help kickstart stuff. But I've been trying to think about like, what's my other workaround? Like, so I actually saw that Lilly, one of the main drug makers for it, is actually doing a trial, where everyone's been talking about, and I'm probably going to mispronounce this, but retatrutide. And it's the new like GLP-3. It's like the new one with like, that burns fat and you don't lose as much muscle possibly as like the other GLPs that you would get. Again, like, it's a lot more aggressive, but also supposedly like a lot more efficient, which I'm sure, comes with, risks and side effects. But, I'm at this point, like, the one thing that really stands out to me is that you don't lose as much muscle mass versus being on the regular GLPs or the terzepatides that they call them. And especially as someone who's trying to recover from their ACL injury, like, losing muscle is not ideal. That's the last thing you want to do as you're ramping up your PT, potentially doing a little bit more runs here and there. I don't know, I'm worried that mix of, okay, I'm like on one of those terzepatide drugs, medicines, injections, and then like I'm losing weight, and then I also start losing muscle, and I'm ramping up my like PT and workout, and I just get injured again because all of those gains that I've had have like gone 10 steps back. So, obviously retatrutide's still new. That's the one that I kind of been looking into it. Again, like, not advertising or promoting. Definitely talk to your doctor, see what your case is. Everyone is different. Again, these are like, I know retatrutide's not like even FDA approved yet. It's in clinical trials. So, at one point I was debating like, okay, if my insurance doesn't want to cover this, what are my options? What can I do? I just don't think I want to spend like $800 to $1,000 on that injection, and that's like taking, resources from my family. Yes, I do want to take care of myself and be healthier, but I don't think at that price point it's right now. So anyway, I qualified for one of their studies, and it turns out that, it was the perfect fit. Obviously, like, I have BMI that's like technically obese. I have sleep apnea. My liver's like, fat. There's fatty liver on it. And I did like a little scan for my liver, which is like, that was the first thing they do to make sure that, you can qualify. and they measure, I guess, like the stiffness of your liver, and it's mine stiff, which suggests that there's like fat around it, and it's like suffocating it itself and not performing to the best that it could. So clearly, like there's markers, right? Like I'm getting sicker, and I think like, I was a little reluctant going into like a study and like what does this look like? I went, I did it, they scanned it, they said I qualified for one of their studies, which is the one that would actually allow me the opportunity to get access to retatrutide, like the right way, being monitored, weighed, possible like DEXA scan of my body fat, whatever. And like they would do a lot of studying. Like it would be more than just a regular doctor's visit. They would literally be checking everything, doing a lot more work on the impact of the medicine on me, which I kind of liked. But here's the trade-off. The trade-off was that, okay, as any kind of study that goes through, there's sometimes a placebo, or there's other options like a third control. And this one has like, excuse me, I'm using the incorrect terms, but I believe there's like 3 controls, and it's you can get tirzepatide, that's one. You can get retatrutide, that's another, and then you get the placebo, which is like nothing, And they'll just still go in, they'll still measure you, they'll still weigh you, and so. I'm at like crossroads of like, if my insurance accepts it and covers it, then I can potentially just start that and be really mindful of just eating protein and working out, so I try to combat that muscle loss. But I kickstart my like weight loss journey, right? I'm cutting back, I'm getting close to getting healthier, my liver's getting healthier, and that's like starting right away. If my insurance covers it, which I have United Healthcare. But if they don't, and they're still giving me trouble, then, I'm going to have to probably consider the study. And I think there's even like a wait period. It's not guaranteed either. But I think, I have technically like a 66% chance of getting a tirzepatide, which is like a Mounjaro or a Zepbound, kind of essentially almost the same thing. There's the injectable GLP-1s, which would help me with the weight loss. Then I have also another 33% chance of getting, Reta, which sounds great on paper, and early reports have showed that it's like significant. It's the game changer out there in weight loss medicine. But again, I don't know how I might react to it. Like either it'll be great for me, or I could be one of those people in those studies because it's so new that it just does not, resonate well with me. I'll get stomach ache, sickness, all this other stuff. That's the risk too. The win is it could be incredibly awesome, and it could be the kickstart that I needed, and I get right there to where I need to, and I'm healthier sooner. And then the other risk is I get the placebo. I waste time. Time is everything, right? Like how many people would pay endless amounts of money to just have time on their hands? And I would be wasting time if I like did the study, got the placebo. I'm injecting basically nothing into my body. Time and energy probably to go back into the office. I don't know how frequent, could be weekly, bi-weekly, monthly, whatever, just to get measured and weighed, and like not moving the scale literally in any way, except for probably gaining weight because I'm thinking I'm like doing something. So those are kind of the options. That's kind of where I'm at now, going into February 2026, trying to see what is like the next best decision for me. And so, weighing it out a little bit. We'll follow up with my doctor, my insurance, first with them, see what's going on. And then, if that's still being problematic, I technically got prescribed Zepbound in like November. It's been December, whole 2 months of like just nothing. Took my sleep apnea test, still nothing. So I don't know. It's just like the insurers, these health insurance companies sometimes just want to wait to your point where there's like no return and you're so sickly, then they'll cover you, which is counterintuitive because they're literally spending more money on you, right? Like why not take these preventative early interventions to help you so that you don't have to, one, be miserable, sickly, and just like being a cost of missing work, not being there for your family, stressing. There's this whole like dynamic that like our health sphere, I mean, I don't know if it's this country or just anywhere, but just like our culture is like not resonant or responsive, or just reactive. It's like, oh, okay, now it's really bad. He has diabetes. He has high blood pressure. Okay, now let's get him those medicines. Why not just, do something that can help you not get there, right? So then you're healthier and you've increased quality of life. So that's kind of where I'm at right now. Kind of, balancing work, different roles have changed too in a good way. And, trying to be present for my family, for my daughter. You hear her screaming in the background. And she's playing her flute now. But anyway, folks, I do want to thank you. Don't want to ramble on too much. Trying to still mess around with my setup a little bit and my lighting. It's a whole different thing. I have a little bit more room now. I have a small little corner office. So, it's in the works. I just wanted to share this update, like a nice health update for 2026. And hopefully I'll have a little bit more time. I'll be more intentional about creating more content and putting it out there. And again, just a big thank you to everyone. Really grateful for all your support. It fuels me to do more and to do storytelling, and it's a passion of mine. So again, thank you all. Thank you so much, and take care. If you haven't followed, please, drop something there or leave a comment. I think, again, I'm also throwing this warning or whatever. Again, not a medical professional. I'm not a doctor. I'm not experienced in any way in these things. If you're considering this or if you need something, obviously first seek your medical professional, a doctor, your own doctor that knows you. Talk to them, and do what's right for you. Do your research as well too, and again, a lot of these new stuff, don't take the risk. It's your body. You could do some irreparable damage or long-term damage before you get back to, hopefully where you were. But, just be mindful as you're trying to get information. If you're going to jump on the TikTok trend where everyone's going to the gray pharmacies and getting these compounds and getting retatrutide from China, be very careful. I don't do that. I wouldn't risk it. Personally, I wouldn't do it. But I know folks are daredevils out there. Folks will do what they need to do. But be mindful. I definitely don't encourage any of that. I got a family. I can't risk them taking care of me if I get terribly sick or a reaction from this. But yeah, do your research. Talk to your doctors. Try to be sensible. Be wise about this. You only have one life. Take care of it. But everyone, thank you again. Thank you so much. Leave some comments. I'm kind of trying to rebuild this community again. I'll do a little bit more streaming too in the future. It's just been, a little chaotic for the time being. But I appreciate you guys and take it easy.